Thank you, Sky Response team, for allowing us to giving us the opportunity to talk to everyone on this webinar. I really wanted to kind of bring what Access has done so far in the tech industry within the UK, and where we are making a lot of way in terms of not just a simple reactive service, a bit more of a preventative service. How can we prevent from people getting fragile, and how can we support them in the right way? So a quick introduction from myself. I would mention at this stage, we recently won the Social Care Premier Supplier Award for the work we've done in London Borough Sutton, which is one of the case studies which I will go through today, and also the Leaders in Care Award as well. We were finalists for the work we've done in Sutton. The next thing I wanted to quickly share is, why do customers value Access Tech? So it's really important to understand that we're not just simply a button and a box. We can deliver a lot more value, and I think that's where we see how can we improve lives of individuals. Yes, the need right now, as part of the analog to digital switch, might be that we need to replace a digital box and a digital button. However, as we know, service user gets more fragile with time. It's how can we support that individual going forward, like you saw from the video, understand the activity of daily living. The AI then learns what's typical behavior, and then creating alerts for the family and for the social workers around the changes happening in the behavior, and then creating a preventative pathway so we can stop that person from going round and round in hospital doors, and staying in home as long as possible. Another area to really mention, what customers really prefer is the interoperability, which is, we're not bound to one solution or one peripheral. We can integrate with 80, 90 different peripherals in the market right now, and with multiple suppliers. So if customers have existing estate of peripherals already rolled out and you want to keep those in place, we don't have to replace those. We can work with you. It's got built-in Bluetooth capabilities as well. So it's ready for the future if we need to attach any medical devices to the solution as well. So we've really thought about, how can we add more value for the customer and deliver the right solution. When it comes to the actual hardware and the solution itself, we have different options. So we have the home base. We also deliver the solution in the housing, as you can see from that square box, and the mobile piece as well. So if the need is to, allow the service user to remain independent when they're going out and about to shopping or going to see family, they feel reassured that they've got something to raise an alarm. We offer the mobile solution. If it's more around in-house, we offer various solutions within the in-house as well. And really, it's all around multi-brand, multi-purpose, delivering all data insights. So, for example, we work with a client who's got dementia again, and he's a postman. And he still, although he's retired, he still goes around, he does his round. So what the family's done is create something called safe zones. And as long as the postman stays within the safe zone, it's okay. The GPS tracking, enables us to, or enable the family to monitor that. And if the person suddenly goes out of that safety zone, that's where it raises an alarm to the family through the family app to say, John's no longer in a safe environment. You need to go and support John. So really understanding what the individual need is and how we can support that. We also take it one step further. We work with Sky Response and a number of social care system care planning solutions as well. So imagine a world where a care worker is walking in to deliver care. They've already got the insights from the last week or yesterday, what changes might have happened in the individual's need through the activity of daily living. So we do have integrations in place where we can deliver a lot more data and value. I'm conscious of the time, so I'll quickly run through the case study. This is the one which I mentioned earlier. We won the award for. So challenge. This is London Borough of Sutton. So London Borough of Sutton were the kind of the early adopters and the innovators, where they had a challenge that they didn't want to do reactive alarms. They wanted to actually improve the quality of the life and the well-being of these individuals living within that borough. They wanted an innovative service model which created more preventative actions rather than reactive actions. And this is where Access, co-designed the the solution with London Borough Sutton. We offered the Tech Home Hub, the app for the family, which really brings the circle of care, involving a lot of different stakeholders which are normally not involved. And you can't rely on all the time on social care workers to do everything. So we really, designed the solution and created that pathway with Sutton. So it's a far better outcome-based approach rather than a reactive service. The outcome is only based on, the stats are only based on the 9 month that have passed so far. So it is not the full realization. And they've only managed to roll this out to 200 service users. So Sutton, London Borough Sutton, instead of rolling out just the hub and the pendant, they've actually by default rolled out the activity of daily living for all their service users. So they've taken that one step further. And the overall service user numbers are around 2,000. So they're going to roll that out for all the 2,000 service users that needs technology-enabled care. So what we saw as an outcome out of that is we managed to help health save around 148k or 148,000 pounds, avoiding 400 ambulance calls by delivering those insights. Also, right-sizing the care package. The activity of daily living helped enable the commissioners to understand, actually, are we giving too much care or are we giving too less care? So they were able to adjust the care packages based on informed data they were getting from the solution. And also housing as well. So instead of removing all the devices from the existing peripherals within the housing, we were able to integrate with the existing smoke alarms or smoke detectors, which saved the housing team around £42,000 as well. Now, as I said, we're really looking forward to realizing the whole value. This is only from the 9 months and 200 service user. I can't imagine what the savings and the values would be once we get all of the 2,000 service users through this journey. The next one I'll quickly share is Wirral Council. And now I do have a lot of these case studies, so I'll share the link after this webinar. You can go onto our website and you'll find a lot of these case studies there, which you can have a look at. Wirral was an interesting one. So Wirral, similar to Sutton, wanted to change the approach from a reactive to preventative. However, they didn't want to get rid of the existing peripherals, which the service users were aware of and used to. So Claire, who used to use her pendant, the wearables or the panic buttons or the smoke detectors, she didn't want to change. So really we work with the commissioners to understand how can we support them and keep those 1,500 installed Chubb devices, but at the same time enable them to be able to deliver the insights which we can support with. So just very quick snapshot of what Mike says. Mike is an installer within Wirral. I'll just say. So again, by enabling Wirral to just attach the peripherals to the hub and not having to replace everything, we saved initial saving around £90,000. Again, that project is not fully recognized yet, so there is more to come yet. I will share these case studies after as well, if you like to, conscious of the time, if you'd like to look into it in a bit more detail. Just giving a quick overview of customers and users. So we do work with a number of local authorities across the UK, either from a in-home solution perspective, which is Assure, or the Oyster, which is the mobile tech solution. So depending on the need, we can support both the mobile ask and the in-home ask as well. Some customers do come out to the market with then ask for a managed service. So we do have specific partners we work with within the UK: Mediquip, PA, Liberty Life, PPP, NRS. So if you're looking to procure the solution through a partner, through a managed service, we can do that as well. And most importantly, we integrate with now with Sky Response. So all our alarms raised in the community are managed through the Sky Response platform. We are Sky Response accredited supplier as well. To finish off with a statement, what I would like to say is that appreciate there's no silver bullet which addresses all the problems in the health and social care system right now. However, what we are seeing that the early adoption of technology-enabled care solutions is helping customers to free up several days in hospital bed space, because they can release the customer with some tech solution and not have bed blocking. really personalize the care delivery to meet the service user need. So rather than just throwing hours at an individual, actually understanding what's their benchmark, what are they good at, and what do we need to improve. So it really makes it personal-centered care. Um, I love this one, providing reassurance to the family, right? So I've got a mother who lives in London. I'm in Birmingham. I need to know that she's eating, she's drinking, she's moving about, and I get the updates on apps. What time she wakes up, what does she do during the day, which provides me the reassurance that mom is okay, and I don't have to go and look after her every 5 minutes. Release capacity as well. I think that's really important. You know, releasing capacity so you can deliver more care. And lastly, conscious of time, delivering cost reductions as well. So if you'd like to learn more around the work we've done from a reactive to preventative journey, or would like to have more information, I'll share the slides and my contact details. Please do reach out. Thank you.